There are several different prognostic tools that exist for follicular lymphoma. The first one that was developed was the FLIPI, which was made in the pre-rituximab era from over 2,000 patients retrospectively. And the FLIPI is a really important tool because it puts together different clinical prognostic factors and groups patients into different risk profiles depending on the number of factors that they have. And that would be low, intermediate, or high risk. The FLIPI-2 was made in the rituximab era, and that added two other factors, which include bone marrow involvement, beta-2 microglobulin, and also the presence of bulky disease. And that was an important contribution because it included patients that were treated in the rituximab era and had a different endpoint of progression-free survival. The M7 FLIPI is the newest iteration of prognostic models in follicular lymphoma. And that's really exciting because it takes the actual FLIPI score, but it also includes mutational status of 7 different genes. And this was done by the German low-grade lymphoma study group. It included these gene mutations, performance status, and the FLIPI score. And all of those together in a multivariate analysis were better than the FLIPI at identifying high-risk patients. This is really important because the FLIPI alone probably overestimates the degree of risk in patients, and over time we need to move into different models that use both clinical and pathologic markers of disease progression. With regards to the gene expression profiling is a tool that we have to understand the number of genes that are either upregulated or downregulated in a certain condition. And in follicular lymphoma, the first gene expression profiling attempt was done by Sandeep Dave, and that showed that the tumor microenvironment in follicular lymphoma is really important at influencing survival. So the more overexpression of macrophages and dendritic cells, that actually impacts survival in follicular lymphoma. More recently, we're learning that you can use actually paraffin-embedded tissue, just the actual archived sample that your patient's tumor comes in, and we can use that to understand gene expression profile. And this was recently looked at the Lugano meeting by the LYSA group, showing that there was 2 different groups of patients that emerged based on their gene expression profiling. So while right now it's still considered a research tool, gene expression profiling I think is rapidly going to be moving into prime time for risk stratification in follicular lymphoma.
We know, and we've known for a long time, that patients with follicular lymphoma can have very, very different outcomes, even with the same treatment. And so one of the efforts that has been ongoing really for the past actually a couple decades is trying to develop scoring systems or prognostic systems to try to stratify patients and predict patients that will do well and patients that won't do well. Unfortunately, most of the systems that we've so far developed, things like the FLIPI scoring system, the FLIPI-2, they're able to predict the outcome of groups of patients, but not individuals within that group. And what that means is that you can take a group of 100 patients, and if a certain percentage of those patients have certain poor risk factors, the entire group will do poorly. However, certain patients within that group may do great. So in other words, patients that have a poor risk score can sometimes do very, very well, and patients that have a very good score can sometimes do bad. Now, traditionally, these scoring systems have been made up by pre-treatment clinical factors. For example, the FLIPI scoring system is made up of low hemoglobin, LDH, stage, age, and number of nodal sites. Each one of those factors gets 1 point. If patients have 3 or more points, then they're considered high risk. And if you look at that entire group, they tend to do poorly. But again, as I mentioned, there are many patients within that high-risk group that can do very, very well. And what that means to us in practice is that, at least today, we don't use these scoring systems to determine therapy. So even though patients may have a high-risk FLIPI score, a high-risk FLIPI-2 score, or a high-risk M7 FLIPI, which is a scoring system based upon certain mutations that are common in follicular lymphoma, today we don't use these to determine treatment because patients can have very good outcomes regardless of their scoring system.